Hello, everybody. My name is Bryan.
And I'm Tim.
You are tuned into Moon Rub, the Lunar Massage Podcast.
Massage therapy when you are quarantined from society. How you been, Bryan?
I'm doing okay. Trying to stay as safe as possible on multiple fronts.
Yeah, for sure. Crazy stuff going on, but
Yeah,
we'll get through it.
right.
Let's see here. So what are we talking about today, my man?
Today, I kind of wanted to talk about how should I say this? Different ways or better ways that clients can actually talk to their massage therapist.
Ah, yes.
Because
I'm into that.
sometimes, oh, go ahead.
Oh no, I'm into this topic, man, for sure.
Okay.
Like there's just sometimes there is a lot of difficulty in just communicating what's wrong with you. Because
Yeah,
most times people don't really know.
right.
Eh?
I was gonna lead off by saying, clients try to be as detailed as possible with what's going on with you. Sometimes say, "Is okay." I understand that you may come in and say, "My neck hurts." We're like, okay, so when does your neck hurt?
Yeah.
How like are you like how does it hurt in the morning? Like after you wake, like when you wake up, or does it hurt when you're driving? Does it hurt when you're at the gym? Does it hurt after you've been at work all day? Does it hurt when you're at the computer? Like kind of like be as specific and as detailed as possible, and kind of show. You can even show us like where it hurts. Like you can kind of touch to it on your body or on our body. You can kind of even make movements or gestures. Like I can only bend this way as far. This is my range of motion here versus the other way. I can go all the way down. Just kind of do your best to be as detailed and as specific as possible, because the more information you give us, the easier it is for us to help you and kind of backtrack not just what hurts now, but maybe that just because an area hurts, that may not necessarily be the source or the reason of the pain. So the
Yeah.
more information we have, the better we can kind of help you trace what's going on and how you got to this point.
Yeah, there's just such a variety of variables with each
Yeah.
different issue. Like
Mhm.
yeah, just I guess the easiest example would be like someone's neck pain. That's a very common thing for most massage therapists to come across, neck and shoulder pain.
Right.
And it could be like anything from some metalhead musician headbanging a lot,
Yeah.
stress neck, to like some office worker just on the computer all day that has a tight wrist from keyboard to his
Right.
elbow to his shoulder to his neck. And no matter how much you work on his neck, it's not going to get
Yeah, you
fixed
got to
because
work.
his arms are messed up or whatnot.
Right.
And so, yeah, definitely learning the cause or the root
Hmm.
of what's causing their pain can affect the therapy a great deal.
Yeah. Even down to you might need it might be time for you to buy a new pillow. It could be time for you to buy a new
Uh,
mattress. Like it could be it's so many different things, so many
I
different
get
reasons.
a lot of people asking me that about what they sleep in and stuff. Yeah.
Yeah.
Mm-hmm.
Or you falling asleep at work. Or you falling asleep in a chair. Like just sleep in a chair. This will wreak havoc on your neck.
Oh man, yeah, that's real. Yeah, a lot
Yeah.
of people experience stuff like that. Yeah, yeah.
And
Even problems caused by what we're not supposed to be doing or whatnot. But we're
right.
all doing. It.
Yeah, exactly.
Yeah, yeah.
And even well also I know not all therapists ask about this, and I try to, and I don't even do it with every client. But
Mm,
you telling us your a little bit of your medical history or background in regards to what type of pills or medications that you may be taking,
yeah.
because as we work on your body, it affects different things like your heart rate, your metabolism. Like it's not just massage. We're not just rubbing muscles. Your body is also responding to what it is that we're doing. So a lot of times it helps us to know what you have put in your body today.
Oh yeah. Especially can get serious with stuff like blood thinners. If you got
Yes.
blood thinners and you don't want to be messing with your circulation if you're trying to specifically take medication for your blood circulation. It's
Exactly.
could mess up what the doctor's trying to do. You got to work with them with that for sure.
Yeah. So things like that. I had I had a client who came in and she wrote on the paper asked was she taking any medicines or medications, and she wrote cranberry pill on the paper. I was like, okay, cool. So you probably trying to detox or flush the system out. Fine.
Yeah.
But when I get in the room, I still ask, and she goes, "Oh yeah, I'm taking something for my blood pressure and something for my diabetes." I was like, why didn't you put that on the paper? Like that
Out of
is a
all
real
things taking, she
yeah.
chose
Like not to downplay the cranberry pill, but you can buy that at like Harris Teeter. Like, I need to know like what's your doctor prescribed things that's going on with you.
Yeah. I don't know
And
if every therapist works this way, but I 100% of the time have a verbal intake,
yeah,
even though we do, of course, like every massage business, have our written intake, for all of our clients for record keeping and everything. But
mm-hmm.
but I don't know. You just don't get proper communication that way. You gotta have a little verbal back and forth before your session to really understand what's going on.
Right. And I know some
Yeah.
of the some of the clients may be watching this now, like, I don't feel comfortable. I don't understand why you need to know. Think about it this way. Let's say you come to my home and you hand me your backpack. And I say, hey, do you have anything in here? Anything important in here? You're like, no, it's nothing in there. Don't worry about it. And I take it and I like toss it in the room on the bed, or I toss it on the couch. And now you respond, hey, wait, my glasses are in there. Or I have a glass bottle of juice in there. Or I have my gun in there. Like it could be a plethora of things in this bag. But I'm handling the bag. So you should let me know what's in the bag, because that will determine how I will handle it.
Yeah. That's a pretty accurate metaphor in my book. Yeah, for sure.
And something, because also sometimes you guys may come in and you may be on different things. And for the benefit and the protection of your health and safety, we can't or shouldn't give you a massage.
Yeah.
Like I had a client come in and he had low back pain. I'm like digging. He's like hard, deeper, deep. And at the time I was working at a place that had an automatic table, so the table's almost on the floor, and I'm giving him full body weight with all elbow. He's like, yeah, I can feel it a little bit. And then he was like, during the session, like, I had some of my cousins walk on my back too, and they're like 200-300 pounds. So I'm like, okay, maybe that's what it is, because I'm not that heavy. So he gets up, and after this, he gets dressed, and after the session, he's like, okay, I'm starting to feel a little better. The painkiller and stuff is starting to kick in. I said, what? So yeah, I took a painkiller before I came in here. I was like, you realize that when you take those things, it affects your ability to gauge how much pressure I'm applying. So you told me that I wasn't applying enough, and I'm pretty sure you may not be able to walk tomorrow. But because you did not divulge this information prior to the session, you have now put yourself in a position to be, further away from your goal of pain relief.
Yeah, that's a really difficult part of the job for us, I would say, because there is no one size fits all when it comes to pressure. Like I always kind of laugh at intake forms that have deep, medium, or light pressure, like circle one on the intake form. It's like, that's not a universal thing. That's ridiculous.
It's not.
Light pressure to one person is deep pressure to another person.
Exactly.
It's something you have to gauge like during the session on the fly as you're doing it. It's like something that you learn from experience. It's something that massage therapists have to learn, like on the job. It's very difficult, to be honest.
Yes.
So, I mean, that's
because I've
so
had
any sort of help we can get from the client, is actually a very big help. Anything verbal, anything history-wise, anything that can better knock out all the different variables going through our head as we're doing our work. Like
exactly
that, whatever.
Yeah, because I've had he was clearly over 6 feet tall, maybe like 250, 260. He's like, I want deep pressure the whole time, because he had been chopping trees or something a few days prior. When I tell you I started to apply deep pressure, this man almost jumped off the table.
Yeah.
Versus I've had like tiny, like petite women hovering around 100 pounds asking for more pressure. I'm like, there's no way you don't feel this.
I've had exactly the same experience.
Yeah, like my shoulder hurts applying this much pressure. I don't understand how you don't feel this.
Yeah. That cliche that women have a higher tolerance for pain than men.
And, I
I
didn't
think
want to accept that until I started doing massage. And
I definitely see that on the job. I will have some skinny, fragile looking lady
yes,
saying harder, 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 and I'll have some big muscle bound bodybuilder looking dude, completely whipping out it,
yeah,
half my pressure, whatever.
right. And I'm like, I haven't even turned it off.
Yeah, yeah.
Yeah,
Oh man. Well, so it's definitely extremely important for these clients to be communicating with us, so as
yes,
to better diagnose them, I guess, is the point we're trying to make. But
yes,
along with while we're on the discussion or the topic of the relationship with our clients, I think we can also talk a little bit about what would maybe be an appropriate relationship with your clients. Speaking of just verbal communication between us, because obviously in the world that's still a pretty big problem.
yeah,
A lot of people don't really, I guess, maybe know where the line is, because it's such a personal relationship. And I mean, for my clients, especially ones that I've been seeing for years, I do have a pretty personal relationship with them. We do talk about personal things in each other's personal lives.
right,
So the line can be a little confusing. But and also not everyone may feel the same way as me or have the same opinion as me, but I do feel like it should be a separate professional relationship despite the personal side of it.
yeah,
Like I if I were to compare it to anything, I'd say like a bartender, like
mhm,
at your local bartender, you may have a couple drinks with them and talk about personal things in both your lives back and forth, but that doesn't mean, the female bartender wants your phone number and wants to go on a date that weekend, like
right. You're absolutely
like
right.
you're one of like 100 dudes she's served drinks to that day. She's just, making money. And it's similar with massage therapists. It's like, I don't mean to be rude, I don't mean to be mean or anything, but like, I'm not trying to be your friend. This is my job, this is how I
Yeah,
make money. Like, I am totally happy to help you with your physical problems, and if you want to talk, I can, it's kind of a weird side effect that we involuntarily kind of become talk therapists on the job as
yes,
well.
yes,
But I have nothing against that. That's a part of the healing process. That's great.
hmm,
But I don't think like I'm not gonna like friend you on Facebook. You know what I mean? I'm not gonna
right.
like uh, be inviting you to like personal social events with
Yeah,
me and
like
my
my
friends.
birthdays and all that type
Like,
of. Yeah,
of course, there's individual exceptions to all this and everything, but like, I mean, it's like inappropriate to be like flirtatious with someone because that's obviously unwelcome, and it's creates an awkward situation where you know don't want to be rude to them because this person's paying you and you're working for a tip.
hmm,
But at the same, so you like almost feel a desire not to speak up if they say something inappropriate or do something inappropriate for that
right.
motivation. So and I
Yeah,
can see kind of a similar thing with like bartenders and any like service industry worker,
hmm,
similar correlation. Not to mean we need to be like 100% like totally cut off. Like if like
yeah,
DC is a pretty small city. I run into my clients like on the train or whatever, and like it's totally cool to like say what's up and say hi in public to acknowledge each other and stuff. That's not a big deal. But so there's definitely a difference between that and like trying to be friends or more than friends. And
exactly.
that kind of brings us to like the elephant in the room, which is we're not sex workers,
Hmm,
which is like a whole nother topic. We could write like essays on
yeah,
this stuff or whatever, but basically the sex work being illegal as it is in this country makes them the creates the need for those people to use things like massage therapy as cover-ups to operate their businesses and to provide their services.
right.
And that makes it harder on all parties involved.
Yeah,
So I don't know, like I'm sure everyone's got different opinions on this and everything, but like from my point of view, I feel like legalizing sex work would fix like 90% of massage therapist problems when it comes to appropriate relationships with a client and therapist.
Mm-hmm.
Because, like, I mean, when you legalize sex work, I mean,
And you mean like
again, just
legalizing it within massage therapy, or like legal as its own separate thing?
its own separate business, because
Okay.
people who run those sort of businesses aren't massage therapists. They're not giving professional therapeutic massages and then
This is
following it up with sex work. You just go
yes.
straight to work,
This is
after
very
maybe
true.
like a quick rub down or something. It's
Right.
like a completely separate service.
Mm-hmm.
So basically, I did a little research for this episode, and I was thinking, like, if you did legalize sex work, then you could like regulate it. That means like which is happening in many other countries, in Australia, in Germany, in France, in the Netherlands. And you can regulate things like STD testing. You can make sure everyone's safe, no one's spreading anything around. You can have less abuse for the people involved. Like,
Uh-huh.
I'm all for sex work for gay, straight, male, female, whatever, but a vast majority of the business is women serving straight men.
Right.
So thinking about it from that perspective, it would be more of like a, you could hire like security guards for these businesses. You could make sure these girls are protected, while
Mm-hmm.
they're doing their job. You could, press charges against, people that are abusive or do things wrong or misbehave or uh, act inappropriately. And then I actually looked up some specific studies to this that have been done. One was from a Huffington Post 2017 article I read that was a study done by UCLA and Baylor in California, where they studied a few years in the state of Rhode Island, where
Okay.
apparently through an accidental legal loophole,
Mm-hmm.
prostitution was legalized for a few years.
Really?
And it's a really interesting story.
Mm-hmm.
But basically, what happened was it became legal for a couple of years. So a bunch of people started doing it. And what was measured was a severe decrease in domestic abuse, rapes, and STDs, all in Rhode Island within those years. And I'm talking a major drop, like over 30% drop.
Oh.
So that's definitely a valid argument. And then in the same
Mm-hmm.
article, they were talking about in Europe, in the Netherlands, since sex work was decriminalized, reports of sexual abuse went down 40% in the first 2 years. I was like, that's a very significant statistic. And then the other article I was reading was from Vox magazine in 2018, a little more recent. And it was talking about the recent legalization of sex work in Nevada, which
Okay.
is, I think, the only place that legalized it in the US right now.
Yeah, I think so too.
And the main focus of that article was the sex workers communicating their need for economic freedom, which I thought was also another interesting perspective, because, we as a society may, judge females for being sexual, which is wrong and sexist and everything.
Right.
But if a poor person, a female poor person, wants to obtain economic independence and economic freedom, that can be a way to like get out of poverty. That can be a way to
Mm-hmm.
get out of a domestic relationship that's abusive or whatever. Like, so it gives like power to these women, which I think a lot of people aren't maybe understanding fully. Like this can, like, I feel like people don't go into that work unless you're desperate for something like money, I guess.
Mm-hmm.
But I don't know, telling them that they can't make money this way and better their lives this way seems wrong. Seems like not my place, not the government's place, not
Mm-hmm.
any anyone's place, really,
Right.
at the end of it. And speaking of gender, like even from the straight male perspective, from our perspective, like I feel like this would also be a really beneficial thing just for like helping with nationwide depression, loneliness, anger, all
Mm-hmm.
the things that do cause these domestic violence and domestic abuse. Like, I wouldn't be surprised if there were correlating statistics with the legalization of sex work, going along with men, going along with decreases in violence, abuse, suicides, major depression, like because they could obtain the services that they need or think they need.
Right.
And I guess to bring it full circle at the end here is how significantly it would help us specifically as massage therapists, and how separating the two businesses separates the two services. Because, I mean, you know, Half Lunar Massage is female.
Yeah.
And they tell me all the time that they get calls every day of people saying inappropriate things and requesting inappropriate services. And, you know, you can obviously tell it really gets under their skin. You know, nobody wants calls every day. And just the mainstream assumption that we would provide those kind of services,
Right.
I feel like the only way that assumption is going to go away is by legalizing sex work.
Yeah.
Because then, you know, it's like they have their business, they have their service. If that's what you want, that's where you go. This is our service. This is what we do. If this is what you want, this is where you go. Right. No secret, no cover up, no whatever, you know, it's like it completely separates in everyone's mind the ideas of what those services provide.
Yeah.
And I feel like that would be extremely beneficial on our end.
That's an interesting perspective. I never heard it from that perspective.
Oh, yeah.
Yeah, but I know, and it's also frustrating on our end too, because I don't know if this has happened to you, but I've had, I don't know how many clients have come in and realized that they were scheduled with me and not a woman, and now they don't want the service anymore.
Yeah, yeah.
And sometimes you can kind of tell, like, you wanted a little more than massage, and you thought that you wouldn't get that, but now you see this black man with a beard, you don't want to be touched anymore. You know, like, now all of a sudden you don't have any pain.
Oh man, even super uncomfortable calls, like racially, people saying like, oh, do you guys have like Asian massage or whatever, like obviously implying something sexual. And I'm just like, man, like, do you realize what you're saying is wrong on so many levels?
I think like, Margaret told me somebody called one day and she said we do have Asian massage and paired the guy with Suishi. And for those of you who don't know who Suishi, he is an older Japanese man. Yeah.
Oh,
I can't imagine that guy's face when he came in and saw who he was working with.
Yeah.
But like, Suishi gives an awesome massage.
Yeah, it's very true.
Like, Suishi is great at what he does.
Again, just stressing the point. I have like nothing against sex work. I think, you know, if someone chooses to make money that way, good on them, you know, like no judgment. But like it is, because it's an illegal service, it makes it very strenuous on us to provide our service without those assumptions, without those comparisons, without people associating us with that service.
Yeah, and that is not this at all. I can't tell you how many anatomy classes I've had to take and things of that nature to study and know the body to be well equipped to do this job. So it's frustrating to be lumped in the category with people who do those types of things. Like, this is not the same thing. And like you say, it's unfair to us, just the industry as a whole, for people to constantly be coming here looking for that service.
Yeah. Well, I guess all we can do now is talk about it until there's some kind of vote on it. So hopefully people are listening. Hopefully we gave everybody a little perspective, a little point of view from our end, so that we can better understand each other, you know, clients to therapists and back and forth.
Yep.
And I miss all my lunar clients. Yeah.
Man,
anyone listening out there, I wish I was working on you now. Someday we will again.
Right. All right. But until that time, thank you guys so much for tuning in. We hope that you guys are staying safe, and we will see you again next week. Bye.
We will. Back again next week. Take it easy, everybody.